Thank you for being here. We are excited to be here to talk about this topic. My name is Kate Turnage. I am a pediatric psychologist who specializes in chronic pain. Most of my time is spent in our child and adolescent headache program at Oregon Health and Science University in Portland, Oregon. I work with kids and teens who have a variety of primary headache disorders. Most of that is migraine or chronic migraine, and I am a clinician first. So I am working with kids and teens for individual therapy, helping them treat migraine and pain.
Kristen Torres. I'm a third year clinical psychology PhD student at Oregon Health and Science University, broadly focused in pediatric health psychology. My research focuses on pediatric health disparities, and my clinical placement this year is with Dr. Turnage in our pediatric headache clinic. So when we talk about stigma in general, it's defined as a mark of disgrace associated with particular circumstance, quality, or person. In this instance, headache. And some helpful synonyms include shame, disgrace, dishonor, humiliation, and reputation. And so when we talk about the type of stigma, we broke it down into three different types of stigma that the research literature also touches on. The first being internalized stigma, which happens when individuals with migraine internalize negative stereotypes leading to self-blame or decreased self-esteem. An example of this would be self-perceptions of incompetence, which impacts self-esteem and self-perception. A common example that Dr. Turnage and I see in clinic are when patients blame themselves of like, I'm not drinking enough water, therefore it's my fault. Is a common stigma of internalized stigma. Public stigma includes the stereotypes recognized by the public, including negative or discriminatory attitudes towards individuals with migraine. So this can look like individuals such as friends, employers, or healthcare providers giving language like, oh, it's just a headache, kind of get over it. And really it's perpetuated as well in the media. And so structural stigma occurs when public stigma influences political, legal, or other organizational policies or systems that limit opportunities for individuals with migraine. And this could look like inadequate research funding, difficulty obtaining sick leave or disability benefits, as well as general laws. And in future slides, we're going to talk about the exact implications of this. And so there's been some research on migraine, but really limited research on other headache disorders. And although this talk specifically talks about headache stigma across the lifespan, there's really limited research in children and teens with headache. So research is mostly limited to adults.
So what we conceptually, when we think about stigma as it relates to primary headache disorders, is there can be a lot of poor outcomes, but it's what we call bidirectional. So there is the stigma that Kristen just mentioned in different formats, and that can lead to poor outcomes that we'll talk about on the right-hand side. But then also these outcomes that happen because of stigma then can further perpetuate stigma. So it can definitely go in both directions. When we're talking about the impact on people's healthcare, this is really broadly just health disparities for people who have headache disorders. So poor health outcomes, avoiding treatment. This has been documented for individuals with headache disorders, but also with other stigmatized health conditions. Avoiding appointments, treatment not adherence, not following up on treatment recommendations. One thing we know for sure is that migraine, it remains a really underdiagnosed and undertreated condition worldwide. One study found that only 10 to 15% of patients with migraine see a neurologist or a headache medicine specialist for their care. The most frequent reason for not seeking consultation is the belief that symptoms are not serious enough or not painful enough, which I really think highlights the real world implication of the stigma. And really, there is this additional piece of behavioral interventions, which maybe is ironic coming from me, a behavioral psychologist, but that these behavioral interventions can lead sometimes to people thinking that migraine is their fault or something that they have full control over and therefore are responsible for. There are broader implications for having lower quality of life. So this is a broad concept of how people and their health, it impacts their ability to live a fulfilling life. So how this impacts physical health, psychological health, some more broad just social well-being. And what we know is that people with chronic migraines specifically have lower perceived quality of life compared to people who have epilepsy or episodic migraine. There is an emerging finding that there is a relationship with increased disability. So the disabling nature of migraine attacks, this is undeniable. Migraine is the leading cause of disability for individuals under 50, and it has a really profound impact on people in their professional lives. We know that migraine is prevalent when people are in their more productive time of their life. And so there can be some of the workplace stigma that occurs with coworkers. This can be particularly significant. And then there's this impact on the self overall. So what this does to, like we mentioned, people's self-perception, but of course to their mental health. It can leave people with anxiety or low mood or feeling helpless or unworthy. There are lots of mental health implications to stigma, and this can be pretty devastating to people. And we know can also then worsen physical health. So it can start to become a vicious cycle. So contrary to what some people might think, maybe not us because I'm a pediatric psychologist, but headaches, they do not just affect adults. We know kids get them too. By the age of 10, about 5% of kids have experienced a migraine, jumps up to about 10% by 5 to 15, and then close to 30% of teenagers have had a migraine. And really, there's been pretty little attention paid to the role of stigma, how it impacts youth with chronic pain more generally, but definitely this includes headache disorders. What we do know is that in kids, stigma can be associated with, again, what we call these negative health outcomes. So avoiding healthcare, not following through with treatment, having worse health just in general, worsening mood that might intensify over time, lower quality of life. And so in this, what you see in this chart right here, this is from a specific research study that looked at kids who are experiencing different types of chronic pain, although there was a small group in here that included migraine. And they interviewed kids and teenagers to find out more about what was their experience with stigma related to their pain. And not surprisingly, I think they found that adolescents and their parents described some pain-specific stigma. And really, this is in a variety of situations. So with their medical providers, with their school personnel, with family members and peers. And so these are some of the main themes that emerged. And Kristen, I'm sure, can say too, we see this all the time in clinic. So people minimizing or dismissing pain, someone thinking that they're exaggerating or making up their symptoms. When people blame headache on mental health problems, oh, you must just be stressed, oh, you must be anxious. Kids who are actively keeping pain symptoms from others to avoid stigma, so the concealability. And then again, as we've talked about, this internalized stigma, so really kind of not only hearing but adopting these negative beliefs and engaging in some self-blame. And then I think a reasonable question is like, why? Where is this coming from, and how is this actually happening? And so the study that looked at this, the categories that emerged are stigma is perpetuated by a variety of factors, right? This pain and visibility, which we'll talk about more on the next slide. People feeling like there is truly a lack of knowledge, and this coming from perhaps even some of their medical providers, a lack of understanding, maybe outside of the medical setting. So lack of understanding from, again, maybe the school, lack of understanding from just other people. And then this controllability, right? So this is really the belief that pain is in the control of the adolescent. Therefore, the adolescent has pain because they're not doing enough to manage their symptoms, or whatever experience is maybe exacerbating their symptoms. So not all disabilities are visible, but all are valid. I like this quote. There's lots of theories about why headache disorders might be stigmatized. I think a really important one is the aspect of invisible disability. Some patients, I feel like, really gravitate towards this phenomenon, or I don't mean phenomenon, like it's not real, but like this concept of really identifying as though they're experiencing a disability that is truly invisible, right? So migraines often are misunderstood or dismissed as just a headache. Um, One reason is it's because it's hidden, and a lot of the symptoms associated with migraine are hidden, right? It's you're not wearing a cast, or you might not be in a wheelchair or have crutches, but in general, people might not know if you have a migraine. We hear this a lot from kids of sitting in class, and if their teacher, for example, doesn't know they have migraine, it might look like they are just completely unengaged or not paying attention because they're rude, for example. And so they're constantly trying to navigate this world where they are having these incredibly impactful symptoms that are impacting their functioning. Other people don't necessarily know what they're dealing with. This I feel like this aspect of invisibility, invisible disability, definitely enhances the experience of stigma. And there is, of course, this more broad lack of support. So, migraine, other primary headache disorders, they do not receive adequate research funding, medical resources, or really other forms of structural support relative to how prevalent headache disorders are and the disability that it causes. So, migraine research has historically received insufficient funding from the NIH, despite the fact that it's incredibly prevalent and has a really large societal impact. Even though it's the most common neurological disease, society allocates a relatively small fraction of the resources it should be getting from the research community for treatment. And one way that scientists describe this is low level of advocacy relative to the disease burden. So, recent research, and what you can see from this chart, suggests that stigma associated with migraine and other headache disorders might explain some of the disparity that we're seeing in funding. So this is from 2018. Yeah, 2018. And these are estimates of NIH funding. These are dollars per million for a sample of neurological conditions and then their disease categories. So it's kind of hard to read, but this very last one at the end is migraine. So this shows us that migraine research is underfunded relative to frequency and disability. Beyond childhood, we know that this continues into adulthood. This is an awesome study that in kind of looking into this topic more, I have come across, but this is from 2022. So this is a population-based study of close to 60,000 people living with migraine, and found that just about a third, so 31.7% of people with migraine experience migraine stigma often or very often. So not only is it prevalent, but it's significant. So we know that for adults, the migraine stigma can be quite severe. And as you might predict from something like an invisible disability, stigma and disability, and really just like the fact that this is this invisible disease is all kind of perpetuating each other. As migraine becomes stigmatized, it impacts functioning, especially in social responsibilities. So for adults, this is really significant for work. And then there's increased disability, right? This might also relate to lower quality of life. And then there's this great relatively large disease burden, right? So this is the disease burden that's happening even in between migraine attacks. Um, a lot of I think it's interesting to point out too that even for adults, there are a lot of older adults who do recall that their first experience of migraine stigmatization was in childhood, and that is kind of like a memory that they are able to recall. So this might come from statements from parents, teachers, or even other people in their lives. So we know that it is relative, or we can assume it's relatively consistent throughout the experience of having the disorder.
So, in terms of fighting the headache stigma and what those who have migraine and headache disorders or their support systems or medical providers and other providers can do, we broke it up into three categories. So, in terms of education, having that as a tool to use and to educate others, there's some helpful resources. For example, Migraine at School has great resources for accommodations for students with migraines and how to manage migraine at school. There's also the Coalition for Headache and Migraine Patients, which their mission is to improve the lives of people with migraine, cluster, and other headache diseases by aligning coalition participants and empowering patient voices. They also have a really helpful language guide of how to best talk about migraine and other headache disorders. There's the Migraine World Summit, which Dr. Turnage has spoken at one of these, and their mission is to reduce the global burden of migraine. So for those with migraine, it's a great opportunity to bridge patient and provider and share perspectives because us as providers can learn just as much, if not more, than what patients can learn from other providers, as well as just other headache society and foundations that increase education and awareness about these disorders. And then in terms of contact, there is some advocacy efforts called Headache on the Hill. It's done by the Alliance for Headache Disorder Advocacy Group. It's in Washington, D.C., one day a year, where volunteers advocate for headache legislation and go to Congress with specific asks, and they spotlight the legislation affecting the headache community. There's also Miles for Migraine, which is a nonprofit dedicated to improving the lives of those with migraine and other headache disorders to raise public awareness and find a cure for migraine diseases. And this resource also has a lot of great education programs and advocacy opportunities at the local community level and can include fundraisers and kind of like a multifactorial approach for addressing migraine. And then there's also public figures with migraine who speak openly about their experience. Include Serena Williams, Ben Affleck, Hugh Jackman, and Lady Gaga. And then also just really emphasizing the power that you have in sharing your own story with migraine and headache disorder, which kind of goes into the next category, which is resilience. As I'm a psychologist in training, but Dr. Strange, as a psychologist, definitely plugging resources of working with a psychologist to really enhance the resilience and coping strategies, especially for difficult emotions that come up with coping with a disorder that is stigmatized. And then learning really how to become a migraine warrior. Sometimes rethinking your relationship with migraine or other diseases and how you experience it can help you kind of think about yourself in a different light and to improve self-efficacy. There's also education and really educating others in your lives, people like teachers, school administrators, or employers to understand about migraine. And Dr. Turnage can speak to kind of in our clinic, we have a set resource guide for these individuals to help them understand. And then to utilize your healthcare team to help advocate for you of what they can be doing for you instead of you always kind of carrying the harder parts of the disease that are harder to manage.